Yes, thank you for the time. My name is Eko. I'm from Jember University. I would like to share about our research. Our research is about the effect of farmer knowledge in the management of emergency. Why? Yes. Why we talk about the farmer in emergency? Because there is the effect of Industry 4.0 to grow up our farmer more fast every step of the farmer. There is four step to or four activity in the agriculture area. The first is selection of farm animals, and there is a high risk of injury and animal viral disease to our farmer. And the second is maintain of the cage. There is high risk of injury due to sharp object in the cage. The third is provision of animal feed. There is high risk of injury due to sharp object, chemical injuries. And the fourth is structure of livestock. The farmer is have high risk of injury due to sharp object. Yes, this is the fourth step for agriculture or activity in agriculture area. In every step, there is the farmer push more fast in every step. Why? Because of this era 4.0 industry, the farmer want to more produce more income on his farm. Based on the prevalence of injury, based on data Riskesdas in 27, the prevalence of injury is 7.5%, and there is increase every year. Every year, step is increase. In 2013, the prevalence of injury is 8.2%. The prevalence of injury in the future, of in 2018, the prevalent injury is increasing. What about the 2020? The prevalence of injury is maybe more increase. Why? Yes, the main factor is an activity in agriculture area. In the agriculture area, there is more activity. For example, activities in agriculture are livestock, fish, plantation, forestry, and agricultural industry. In daily activity of our farmer is, for example, superior seed selection activities, livestock maintenance, chemical nutrition, outdoor activity, and product sales. And the third factor in our agricultural is health status of farmer. For example, is the status of nutrition the farmer, status of non-communicable disease, infection disease, incident of injury, and the main status is family health of farmer. This is the three factor in our research. The first is agricultural area, the second factor is daily activity, and the third factor is health status. So, will emergency identification help farmer to implement effective prevention program? This is our research question. The method in our research is use design quasi-experimental design with pre-post-test design without a control group. In participant a farmer from Insan Mandiri Foundation of Lumajang. In this our research use sampling simple random sampling technique with total 33 respondents. In this our research use analysis the main Whitney test. The result is in our research is education is the most education is junior high school. What about the knowledge of CPR is enough with p-value 0.032. And what about the factor of knowledge of injury? In knowledge of injury, there is good knowledge of injury on the post-test question with a p-value 0.002. What about the knowledge of transportation? In the knowledge of transportation is good based on post-test with a p-value is 0.00. This is our result for our research. An exercise program to improve basic life support knowledge and skill in farmer has done simply. Why? Because of the education of our farmer. Participants were given the opportunity to demonstrate the technique and the step they had seen in phantom cardiopulmonary resuscitation or CPR media. We use CPR media to simulation in our education program. Injury management education to farmer is very necessary because agricultural area have a high risk of trauma. We know that the activity in agricultural area have a high risk of injury. Farmer need health education and training in handling injuries and proper transportation technique in handling injury due to hazardous material in agricultural area. Yeah, this is the fourth analysis in our research. So the conclusion in our research, the first is every activity in the agriculture area requires education on cardiac arrest management. And the second, Every activity in the agricultural area requires education about managing injuries due to the sharp or blunt objects. And the third is every activity in the agricultural area requires education on proper transportation procedure. And the fourth, every activity in the agricultural area requires education about emergency as a preventive measure. And this is our team. In the picture, this is our research with our farmer, and our research is dedicated to the farmer of Indonesia. Thank you for the time. And thank you for me and our team.
The effect McKinsey exercise for low back pain at agricultural area, a literature review. Outline. This one is background, 2 method, 3 result, and 4 discuss and conclusion. Background. Low back pain is a pain syndrome experienced by individual caused of pure body position resulting in injury to soft tissue structure which include muscle and ligament. Low back pain is one of the factors of morbidity and mortality in agriculture area. The prevalence of low back pain in the world has been reported with an estimated mortality rate of 10 and incident rate in Indonesia around 3.1%, the highest in agriculture area, more in adult than other groups. One of the ways to reduce discomfort in low back pain is the McKinsey exercise. McKinsey exercise is a way to deal with low back pain to make it easier to deal with pain and easy to do every day. And study exploring the effect of McKinsey exercise at patients with low back pain. Method design, we use literature review study, and we use systematic research to find the related publication literature. Time, the literature search in based on the 2016 until 2021 publication years. An objective article, we use the literature review must meet a full text treatment by use an online search on the PubMed, Fingerlink, and Scholar database. And subject, we search keyword our McKinsey exercise, low back pain, or farmer. The flow of the literature research. Objective to compare and analyze the effect of McKinsey for pain in Scholar, PubMed, and Fingerlink. We use 216 for, and potential relevant article identified is 22. So excluded article is 13. They are non-English or non-Indonesian, no full-text article, and child population. So we use 7 articles with full-text article, studies published science 2016, and effect of McKinsey for I. The results for the technique, 5 articles use McKinsey exercise, and 1 article use McKinsey exercise and control exercise, and 1 article use McKenzie exercise stance and traction technique. For duration, 3 articles used 2 times for 1 week, and 3 articles 4 times for 1 week, and 1 article 5 times per week. And instrument use the numeric pain rating scale or NPRS for all articles. And effectiveness is all article show is significant with U value 0.05. Discussion and conclusion. Muscular complaints are more often experienced by people with the less elementary school education, as much as 34%, because education also makes people do not understand what is health, and 89% have working periods of less than 10 years, and 90.9% work position with the direction of judging of body and holding weight. So McKenzie exercise that often occurs is done with the brown line technique, where exercise combines all the muscle and has the benefit of reduced pain in low back pain and also relaxing the muscle. In conclusion, intervention of McKenzie exercise to reduce low back pain in using McKenzie exercise technique in general, and the average duration of training is 20 minutes per session, performed 4 times a week for 4 weeks, and McKenzie exercise has a significant effect on the reducing low back pain, and muscle rehabilitation is used safely and without side effects. Thank you.